I am the program director for Voices for Prevention, and I also am the executive director of Let's Be Clear, Georgia. We have a board member of Let's Be Clear on with us, Miss Ginger Kester. So thank you, Ginger, for joining us. And that's a collaborative to prevent marijuana abuse. Um, so I've been dealing with the marijuana issue pretty specifically since 2015. When legislation first began. So that's me. In the interest of time, if you could all be very brief in your introduction, I'm sorry about that, but we only have about 20 minutes to cover everything we want to cover. So if you could just briefly introduce yourself and just chime in whenever.
Well, hello, everyone. I work with Voices for Prevention as a project manager. So this is my first SAPAD event, and I'm really excited to get all the information today from Greg. So hello.
Hello, everyone. I'm Lindsay Grovenstein. I'm the project coordinator for Beyond the Bell. We're a local nonprofit in Savannah, Georgia, working to prevent underage alcohol, marijuana, tobacco. Excited to be here with you all.
Good afternoon, everyone. Oh, okay. My name is Zuri Jackson. I'm a student assistant specialist with Caring Treatment Centers. And we also do tobacco cessation and awareness, intervention, prevention, all of that in high school and middle school. Good to meet everybody.
Hi, I'm Ginger Kester. I actually serve on the Let's Be Clear executive board with Dr. Raduca, which I am very excited to be a part of, and it has been a wonderful experience for me. I actually started a company called, or an LLC called Parker's Promise in honor of my son.
Good afternoon. This is Dee Anderson from Decatur Prevention Initiative. Hi, Greg. 1997. We go back.
87.
I'm with Terry Moore. Blessings, everyone.
I'm Annette Boswell with White County Family Connection. I'm a family advocate, and I work with middle and high school students.
Hello, everyone. My name is Yolanda Moon. I'm with Caring Treatment Centers as well, a student assistant specialist.
And some others who haven't introduced themselves yet.
Hi, I'm Kathy Wendholt McDade, and hello, Dr. Raduca. I am on the Let's Get Clear board and am semi-retired from the state office, DBHDD, Office of Behavioral Health Prevention. Worked on marijuana, tobacco, alcohol issues for many years, right?
Thanks, Kathy.
Good afternoon. My name is Amin Kush. I also work for Caring Treatment Centers in the Atlanta area, with student assistant programming. And definitely we do a lot of tobacco and marijuana cessation programs. So looking to get a lot of good information and connect with you all.
Hi, everybody. I am Nakia Cross. I am the assistant project manager for the ASAP project and the project manager for the PASS project with the Council on Alcohol and Drugs within Region 3.
Thanks, Nakia.
Hi, everyone. I'm Melinda Goen. I'm the data analyst in the DBHDD Office of Behavioral Health Prevention and Federal Grants.
Hey, Melinda.
Good afternoon, everyone. I'm Cassandra Daniels as a project coordinator with Mitchell County Children and Youth in Southwest Georgia and have 2 youth action teams.
And do we have 1 or 2 more people?
Well, we have one in the chat here. It's Lindsay, and she just wanted to say hello. She doesn't have a microphone right now, but she is a certified peer specialist with mental health, youth and mentor, and an active member of the local recovery community. I do apologize.
Okay. Is that everyone yet? Okay, well, let me go ahead, and I'm going to go a little quickly. So if you miss anything, please let me know, raise your hand or something like that, or just unmute. But I was wondering if you could raise your hand and let how many of you have previously attended Substance Abuse Prevention Advocacy Day at the Capitol? Just a show of hands if you'd uh, come on and start your video so I can see how many of you, or raise the hand in the chat.
You can also do the reaction button at the bottom
Yeah,
if you
reaction
can't show your
button.
video.
Okay, so as far as I could tell, about half I saw a yes from. So, and how many of you have visited with elected officials in the past? And if you could put yes or no in the chat, and Ziamara, if you wouldn't mind taking a look at the chat, or just raise your hand again for those of you who are on video. How many of you have had a chance to visit with an elected official in the past? Okay. Okay, just a couple. All right. So thank you for that. So really what this is all about is motivating we preventionists and treatment folk to meet with our elected officials. A lot of us haven't done it before. And so a lot of us kind of need some confidence and capacity to visit with those elected officials. And just to say, that there are people too, and we want you to visit with your state senator or state representative, and those folks really work for you. We want you to visit with those folks that you may have voted for, you may not have voted for. You don't have to go into that during your visit, whether they're a Republican or a Democrat. And just, let them know that you live in their district, and you don't have to say that they work for you, but in essence, that is the fact. So they are really there to serve you. We all pay taxes, state taxes, and some of those taxes do go for their salaries, although they don't earn very much, and they do work extremely hard, especially for those 3 months that the General Assembly is in session. And because of the COVID-19, we're not asking you to make those visits in person. We're asking you to make those visits virtually. And for some of you, that'll be easier. For some of you who may be novices at Zoom or WebEx or MS Teams, whatever virtual platforms there are, it may be a little more difficult unless your legislator may be willing to set up that Zoom meeting himself or herself. But today is really about trying to give you the confidence and capacity to have those virtual meetings, because that's really the crux of advocacy. And we're not asking you to lobby, which is to influence them on a particular piece of legislation. Most of you are with nonprofits. For those of you who are with a for-profit, you can lobby if your supervisor allows you to do that, and tell your legislator how to vote on a particular piece of legislation, which is a little more powerful, you might say, than education. But education is so important because so many of the legislators only hear what they hear from the media. And many times, especially with the marijuana issue, the marijuana industry kind of controls the media. And so a lot of what they hear is what the general public hears, which is all the good stuff about marijuana and not some of the side effects that we preventionists and treatment folk know about, and how much suffering that marijuana can cause for so many people. So that's really what today is about. And at any time, especially those of you who may be newer to this, you want to reach out to me, you want to reach out to Esther about questions you might have about how to make an appointment, we sure want you to do that, and we're here to help all we can. We are going to go over a discussion guide on marijuana, and this is not quite available yet. It's being reviewed by DBHDD. As soon as it is reviewed, we will put it out in an email and put it on our website so that it will be available to you. And we're hoping that it will be available very, very shortly. And this is our discussion guide. I'm not going to read everything that's in here because there's a lot of information, and I don't want to bore anybody, although it's very important information to have. So it starts out with an overview, a little information about Voices for Prevention, and then what I just mentioned about the media and the internet, what I mentioned about another side of the story. And all of you, I know, 90% of you, and from your introductions, all of you are people persons. You have a lot of compassion for helping people, and it's important to let the senator or representative know that from the get-go. By the way, I think I forgot to mention, if you don't know who your senator or representative is, don't feel bad. A lot of people don't know. Ziamara, if you would put the openstates.org web address, www.openstates.org, in the chat box. It's a very easy way. It takes a few seconds or maybe a minute just to find out who your state senator, your state representative are.
Okay,
So
I'll do that for you now.
Thank you, Ziamara. So, what's legal now is THC oil, and that doesn't sound like marijuana. So many people get confused that THC is something kind of different than marijuana, that THC oil is not marijuana, but in fact, it is a form of marijuana. And actually, it's a very strong form that even 4 drops of legal THC oil can get one high. So that's what's legal now in the state of Georgia. So some data points, because it's always good to have some data to back up what you're saying and have that data at your fingertips. So talks about 2018, almost 12 million young adults reported marijuana use in the past year. As many as 30% of those who use marijuana on more than an experimental basis may have some degree of marijuana use disorder, and that means abuse or possibly dependence on marijuana. Those of you who are with Karen know about those degrees of diagnoses that are in the DSM-5. And the trouble is that one of the effects of THC is on the brain, and there's so many receptors in the brain that are cannabinoid receptors that interact with the chemicals in marijuana, particularly THC, and so that the brains of children, teens, young adults can be seriously affected by ingesting marijuana in various forms. There's risks of premature birth, low birth weight. That's documented by the Emory School of Medicine, their Maternal Substance Abuse Center, people dying on the highways. And unfortunately, we never hear about that in Georgia because we're not measuring it. And when it is measured, it sometimes isn't reported. Our system for reporting on marijuana intoxication, for measuring it, is very complex. It's very complicated. It's loaded with problems, which we don't have time to go into today. But just know that if we're like other states who are measuring this, we've got folks dying on our highways. I would guess every day. Now that's a guess, that's not science because we don't have the data. But in Colorado, which has about half the population of Georgia, they have about 2.5 deaths a day that are THC marijuana related on their highways. And the tax argument is not a real sound one. As we know from alcohol and tobacco data, the taxes that you get in are a lot less than what goes out in the costs of what it costs society, what it costs the taxpayer to deal with the health and social effects of legal marijuana. Now, we don't have time today to go into the difference between decriminalization and legalization. And we are for decriminalization as long as it has a drug evaluation followed by a prevention program or a treatment program. But there's a vast difference between legalization and decriminalization. So what we're worried about is legalization. So this is followed by some frequently asked questions and then some sources, and these will be available to you soon. So at this point, I'd like for this to be as much of a discussion as it can be. And I was wondering if you all have questions or comments that you'd like to make. This would be a good time for that. And you could either write the question in the chat box, and Ziamara, if you would take a look in the chat box, or just unmute yourself. We're a small group, and just let me know if you have any questions. Are there any questions in the chat box or any comments that anybody has?
Not just yet, not in the chat box.
Okay.
And remember, everyone, this is the opportunity to ask any questions. If there's something you're worried about a legislator asking you or how to approach a certain topic, this is the time to kind of express that, and we can answer it the best way we can.
And please don't feel like any question is too simple, because this is tough, some tough stuff and some new stuff. So no question is too simple.
And we just got one question in the chat. Oh, two. The first is from D, and it says, are the smoke/vape shops popping up around the state forerunners for marijuana shops to come?
That's a great question. I don't know the answer to that for certain, but I do believe so. The way the current law that passed in 2019 is written is that it allows for what are called retail outlets, and that's the language in Georgia law, to sell these medical marijuana products. There are 5 of them, 5 different THC products that these retail outlets can sell. And because the law is worded that way, it doesn't say medical marijuana dispensaries, it just says retail outlets. My best guess would be like the CBD shops that have popped up. We're going to be seeing some THC shops, and the vape stores are really set up to do that well. You know, I went in to buy a vape pen, and I won't go into it now, but boy, they know their stuff when you go in there. They're at least the salesman I spoke with, very technical. So, yeah. There was a second question?
Yes, there was another question from Cassandra, and she asked, what are the best state resources to get data on marijuana?
Oh, that's a great question. Well, we're going to be giving you, some through V4P. We'll also have a fact sheet for legislators, and we've also got some tips for talking to legislators, which I'll go into in a second. But there's also the Let's Be Clear website. And Ziamara, if you would also put this in the chat box, it's www.clearga.org. clearga.org. And
Perfect.
on there are especially a bunch of videos and educational tracks on 20 different topics. And you could also Google for Facebook. We're on Facebook, ClearGA. And Ziamara, do you know how much time we have?
Yes, we have about 5 more minutes that we can continue the conversation.
Okay.
Before we rejoin the larger group.
Great, because I'm going to go into the tips for dealing with legislators, and this is an important one. And this is tips for meeting virtually with these legislators. So it may seem intimidating at first, and this will be available to you today. Unfortunately, we can't make it available to you today, but it will be available in the near future. So, so prior to the meeting, what you need to do to prepare, know your homework, and also, you know, we want you to be passionate about this issue, and we want you to deal with an issue that's happening in your local community. You know, if you have a personal story, for example, we'll get into this in a bit, about someone you know in your community that's been affected by this, it would really be good to tell that personal story. And that's a really good starting point for a meeting with the legislator. And it's always good to begin by thanking them for what they do. Whether you agree with them or not, they really do have a hard job. It's a lot of pressure at that Capitol, and I've been down a lot, and they have to deal with maybe 300 bills a year with one staff person or one part-time staff person. So arranging the meeting to in that. When you find out who your senator or representative is, you can go Google their name and georgia.gov to find out their phone number. And probably their phone number actually is easier than that, will be listed on openstates.org when you go to that website. If you don't see it there, and ZMR, if you could put this in the chat box, Google for their name followed by ga.gov. And that's a great website for bringing up your legislator's page, and you can see stuff about them, like their bios, for example. So you might, it would be ideal to ask your legislator if you can set up that time with them, but it's probably a staff person you're going to talk with to see if you can set up a time for a virtual meeting. If you don't know how to do virtual meetings or set those up on Zoom or MS Teams or whatever, please let us know and we can help you with that, unless your senator or representative tells you, oh, we have that set up already. You don't worry about it, just join us on our Zoom meeting. And here's what you can email them ahead of time, the fact sheet that we'll be providing for you. But we'd like you to localize this fact sheet with your logo, your local data, and your specific issue that may relate to marijuana in your community. That's going to be so much more important than a more generic piece from Voices for Prevention. Tell them a little bit about yourself, because make it a personal visit. They're people just like we are, and so personalize the visit as much as you can. Read their bio by Googling their name in georgia.gov. Mention if there's an overlap between you and your legislator, talk about that overlap that you have in an interest that you have in common. Be focused. They may have only a few minutes. Hopefully they'll more than that. You may want to have some youth with you, not necessary, but go in a team of 2 people and do like youth. They listen to adults a lot, but they're very impressed when a youth, and it could be a recovering youth who's been through with marijuana, is present for that virtual visit with you. An elevator speech is important, 1 to 2 minute speech that's really focused. Because you don't want to get off topic when you're meeting with them once you get down to the heart of the matter. Here are some steps for the ideal meeting. We talked about the first 2 already, and then also good to tell them about a solution that prevents what happened in the story that you're telling them, and then make the ask, what is it that you'd like them to do? And this is a very important piece that you don't want to leave out. What is it that you want them to do about your particular issue? And there are various other asks. If there's anything that they think that can help your organization about this issue, and ask them to be open to listening to you in the future in a diplomatic way, but you really want their ear going forward, not just at this meeting today. And this could be a long-term relationship, and hopefully this is the start of a long-term relationship with your legislator. To be aware
And-
about the most important substance abuse prevention legislation, ask them to be aware of that. What comes up, the session lasts from January through the end of March. So it's a 3-month session.
And
So you
Greg, I
want
just
to-
wanted to let you know about the 2-minute mark before we're
Okay.
about to join in with the rest of the members who are joined. But I wanted to verify with you the web online address that they can go to after they find their local senators to get their contact information. What was that? You said they can Google their names and
Yeah.
then
What I
follow
do
it
is I
by.
just put their name in,
Mhm.
and then I add the ga.gov. And when I Google that, then their georgia.gov webpage comes up. And it's just a very easy way to you see their picture too, which is good. So you know what they look and their bio, which is really good to know.
Awesome.
And just getting a note, my internet connection is unstable. I hope everybody can still hear me okay.
Yes. I can see you fine now. It was
Okay.
glitching a little bit, but it's definitely back on now.
Okay. So this is the kind of infographic that we're going to be sharing with you. This is the fact sheet for legislators. And again, this will be available to you soon, but this is a much better way to present the information to them. As you
Greg,
can
we
tell,
don't see the infographic just yet. We just see the marijuana topic discussion on Word right now.
okay, I'm not sure
You might have to
why.
stop sharing and then share that new document.
Oh, okay. Thank you, Ziamara. Can everybody
problem.
see that now?
Yes, we see it now.
Okay, thank you so much. So yeah, this is the fact sheet that you could give to them, but again, it would be good to personalize this as much as you can. And if you need help with that, let us know. But see some of the facts regarding what I was talking about, the pregnancy and the cost and taxes and developing brain and so forth. And there are some of the sources of information. So any questions or comments about any of that before we have to break? Go back to the main room. And my email address, and Ziamara, if you might put this in the chat box, is graduca@livedrugfree.org. graduca@livedrugfree. So just feel free to email me.
Yes, I put that in chat.
Thanks.
No problem.
And
okay, and it says we have
we're going
50.
to close in 57 seconds.
Yes. So once again, we have some great resources in there in the chat box where you can find your legislator, and we will definitely be posting this information on V4P and Let's Be Clear. We will have these fact sheets up as soon as we get the final approval and they're finalized.
So any questions that can be answered in 30 seconds? As they say on TV, we have 30 seconds.
Oh, we just have a lot of thank yous in the chat right now, Greg.
Oh, that's nice. Well, all are very welcome.